Colorado officials are investigating a suspected second case of a new, more contagious strain of COVID-19. This case is believed to be linked to a Colorado National Guard member who had been working at a nursing home struggling with an outbreak just outside of Denver. Officials on Tuesday confirmed the state's and the country's first case of the mutation in another guardsman working at that location. Both men were sent to the nursing home on December 23rd. They're now currently in isolation. Colorado's Democratic Governor Jared Polis joins me now. Governor, thank you for taking some time with us. Let me get into it here. Health officials say neither person has traveled internationally in recent weeks. There's also the potential for other untested cases and cases that we don't know where they came from. Do we know how this strain arrived in Colorado?
Well, we don't. With the timeline, it seems unlikely that the National Guardsman contracted it at the care center. It's likely that they hopefully didn't introduce it there either. There was already an outbreak at the center. They were there, and 2 days later or a day later tested positive. We didn't find out the variant until several days after that. So that's an unlikely short incubation period. So it's more likely they contracted it elsewhere, but we just simply don't know. We are running the DNA, RNA tests from RNA, it's virus, from the senior care facility, from others who might have been exposed. I think what everybody in America wants to figure out is how prevalent this variant is here. We know it's not likely the first case in America. It's just the first one that we were fortunate enough to catch and find.
Obviously, it's here now, and you have to logically think that there may be others, obviously, in your state if these two National Guardsmen tested positive. What is the state doing to identify other potential cases, either in that nursing home or elsewhere around the state?
Yeah, so we're doing the preliminary screening for it on many of the test samples we receive, and if the indicators are there, we can put it through the rigorous analysis necessary to isolate the strain. Certainly with everybody in this potential exposure chain, but we're also doing a sampling across the board to try to determine how prevalent it is. In Colorado, I fully expect that other states will identify this strain in the coming days.
The ski industry, a big part of your state's economy, and ski season obviously in full effect here. Could this new strain put that in jeopardy?
Well, there's no known link between this strain and an experience on the slope. Skiing itself is very safe. It's outdoors. It's socially distant by its very nature. The difference in many of our ski communities, which are having a good ski season so far, and people who want to ski can enjoy that, is that the town piece is different. There is indoor dining, but it's limited. The downtown areas, many of them require masks, so different. Looks a little bit different, but certainly the ski and boarding experience is the same. It's safe. It's outdoors. It's great. We encourage people to get out.
Well, and as somebody who has been skiing in your state, I mean, there are the lodges. People are gathering, and I know there's some restrictions not only on mountains, but also in the towns. There are people who are going to end up gathering. I mean, skiing is a social event, really, even though on the slopes you may be separated. If things get worse, is there any possible restrictions or lockdowns?
Well, ski with who you came with. So, for instance, if you're skiing with a party of 3 or 4 people, you can go up on the lift alone or in a gondola alone. If you're willing to go up with somebody else, there's a spacing between you. But even the experience on the lift, very safe. You're going into oncoming wind. You're not really exchanging it with somebody near you. There is mask wearing, but for parties of 3 or 4, they're generally just riding up alone with the people that they came with. So look, I mean, people who avoid every risk are staying home whenever they can, but certainly many people are willing to explore the great outdoors, which are much safer than indoor environments.
The vaccine rollout is now underway well across the U.S. since we have you here and you can talk for Colorado. How's the process been so far in your state? And do you feel that you guys have enough to vaccinate healthcare workers and vulnerable populations?
Well, we hope the supply is reliable and increases over time. Today, we announced that we are focusing on everybody 70 and up. We expect, given the quantities we think we will receive, to be able to inoculate everybody 70 and up with their first dose in about over the next 4 to 5 weeks. That's already started today in many areas of our state, as many areas finish the frontline healthcare workers exposed to COVID.
Your state is now moving into a new phase of distribution. I guess 1B, I think, is what you're calling it. It's including teachers, public transit workers, post office workers, and also workers in the executive, judicial branches and legislative branches there in state government. What are you hoping to accomplish by kind of moving this group up in the line?
So, to do everybody 70 and over, we found that 78% of our fatalities in Colorado were age 70 and up. So we can reduce our deaths by 3/4 or more. And then, of course, those that are critical for the response itself have high exposure to others, like grocery store workers, teachers, and others. Very important to provide that protection as soon as possible. Those will generally be scheduled with a lot of the school districts and grocery stores, in late January, early February.
Any particular plans? You have some rural areas that I've been around your state. Sometimes are kind of tough to get to. Any special attention and care you're giving to those areas so you can physically get enough vaccines out there to people who qualify and want it?
Yeah, it's harder to move the Pfizer vaccine because of the conditions that it needs to be maintained at. So we look at flexibility when we're looking, the Moderna and Pfizer vaccine, both equally effective, both 94 to 95%. But in general, we have to be more selective about if a place can accept the Pfizer vaccine because they do have the facility, that's the one they're going to get, because we need that flexibility with Moderna to get it to many of our rural areas because it simply requires a regular cold chain that, like a regular freezer.
But anything for people who are in those remote areas of the state, are you going to try to bring them to certain areas to come get it, or are you going to have to bring it out there to those rural areas? I've spent a lot of time in your state, and it's some places are tough to get to.
It's through hospitals, community health clinics. So, I mean, if you live in the middle of nowhere and the nearest hospital or health clinic is an hour away, it's probably that hour drive for you. But most of those hospitals and community health clinics are in or near the population center of rural areas in eastern Colorado, in western Colorado. As time goes on, it'll be able to be devolved to the pharmacy level, including in-store pharmacies at grocery stores, but we're not there yet.
Governor Jared Polis, thank you very much for your time and good luck in the future of distributing this vaccine in your state.
Thank you.